Hey everyone, welcome to the Freedom to Flourish podcast. I'm Dr. Joel Miller here with my good friend, Dr. Tim Augustyniak. Today we've got a good one for you guys. We are jumping into the topic of parasites. We're going to talk about what are parasites. We're going to talk about the different types of parasites, the different symptoms that parasites cause. We're going to talk about how you probably do have parasites, but how to go about that whole process. We're going to talk about the signs and symptoms, of course. How to identify them, and then we'll get into how to get rid of them. Of course, we'll get into talking about herbs and our top findings there and recommendations. And then we'll also talk a little bit about ivermectin and fenbendazole, as those guys have created a lot of just kind of noise lately in kind of the health world when it comes to parasites and even cancers and other serious conditions like that. So we've got a lot on the table for today. Dr. Tim, this is, I think, going to be a really good episode. I know we say that about every episode, but we like to talk about things that are important. And obviously, we find parasites a lot in practice. And so this will be something that I think this is one of those other topics, Dr. Tim, that it's very, very relevant to people's health and their health issues, even in America. But we don't see doctors talking about it very much.
Yeah, it's going to be a great episode. Parasites are all over the place, and it's just a matter of whether or not your body's reacting to them. On your note of talking about those medications, the fenbendazole and then ivermectin, I think it's important to also note, so within our scope of practice, we are chiropractors, so when we talk about these things, we're not really going to provide a whole lot of, suggestions as far as it goes for, utilize them to treat, things like that. We just kind of want to bounce some ideas around regarding, it's getting pretty big in the functional medicine realm. And so just the take that people are having on these things, and then there's a lot of medical doctors who are in the functional realm who are using these things. So we just kind of want to talk about how those work and how that kind of plays into maybe like a co-management scenario with the methods that we utilize. So it's all going to be good stuff. We're going to give our take as far as it goes for how to identify these things. And then from there, what nutrients we're going to utilize to fix these things, as well as some various conditions, things like that parasites can cause, and how our side as well as the other side are going through it and trying to fix these things. So it's really, really going to be good. I think we kind of saved, as far as the infectious episodes go, one of the best ones for last. So, but with parasites as a whole, you had made a really good point that, you mentioned even in the United States, we have issues with parasites, and it's a pretty common thought that our patients will hear from their medical doctors. Oh yeah, you don't get parasites, in the first world. It's just not something that we have, because we have better cleaning, but better hygiene, all those things. And quite honestly, it's really not all that true. There's various protozoa, amoebas, things like that can make their way into water, foods, things like that. And it's just as easy for us to get something that's undercooked and has issues as it is somebody else who's in the third world. Just need to make sure that we have good practices with food and water, things like that. And so that just brings us to our first point: is where do parasites come from? There's plenty of places they could come from. Dr. Joel, why don't you kind of walk us through the top places that you have that come to mind that parasites typically come from?
Yeah, for sure. So in similar to our other episodes where we talked about bacteria, we went through that whole topic. We went through the topic of fungus and those different microbes. And I'm sure we'll do an episode on viruses here soon as well. But kind of to those points, these things will literally be everywhere, like you said. And so, there's kind of the common places we talk about where it's like, okay, maybe it was in your water, maybe it was in your food, maybe your meat wasn't cooked all the way, maybe some raw seafood of some kind, things like that. And then, of course, you have your environment. Now, in all of these things, Dr. Tim, like you mentioned, like you alluded to, and we've talked about in the past multiple times, is that it's not so much the presence of these things, it's how's your body reacting to them, how's your immune system responding to them, is your immune system weak, is your immune system getting infected by these things, or if you're exposed, which we all are often, how is our immune system, how's our nervous system, how's our body doing with these things? So when it comes to the environmental piece, this is also an extremely common place where environmentally you can be exposed through your pets, you can be exposed through loved ones, people you're intimate with, people you're drinking after, all these different things. And so what we want to continue to emphasize kind of through this episode and through just the overall talking about holistic health and talking about how God created our body, we want to emphasize that it's not necessarily the microbe as much as it is your environment, your body, your health, and it's how your body responds to those things. And so those are kind of the top places that I'll see parasites and kind of, yeah, where do they come from? But also, another way maybe to say that or ask that is, how are we getting exposed to these things? And what are the common sources there? And what are the sources that we're getting exposed in high amounts? I would say if you're drinking tap water, you're probably getting pretty exposed there, but that might even be a slightly different mechanism just because of, if you're drinking tap water, you're getting all kinds of metals and chemicals and things like that. And that alone will impact your immune system. But I would say one of the biggest sources I would say people are getting exposed is through their pets. That's extremely common. And then also just through loved ones. I would say that's pretty common as well. Dr. Tim, is there any other sources that you'll kind of see with that as far as parasites, being exposed to them and things like that?
I just think that environment is kind of an umbrella term for a lot of different places. I think it's just important to understand that they can basically come from anywhere: food, water, other people, soil, being anywhere in nature, really. So just making sure that you're washing your hands and washing foods, cooking properly, all those things can help us avoid that. Yeah.
Cool.
But then from there, I think the next thing that we want to get into is just different types of parasites. So when we say parasites, it's not necessarily that we're just always thinking worms. People hear parasites and they think worms that are just, these big long tapeworms that snake through your entire intestines and all this stuff. We kind of already said protozoa is one of them. Just these little single-celled organisms that can cause problems, things like Giardia or other issues. Other ones that are on the list are helminths, which are worms. So it's tapeworms, pinworms, ringworm, hookworm, all those things that can cause some problems. And then there's things like ectoparasites, which are things like ticks and other external parasites that, like dust mites, things like that can actually live on our skin and eat our dead skin cells. Are technically parasites, but just like we always talk about reactivity, you can have dust mites and various things like that eat your skin cells that shouldn't really cause any problems, but that's where ticks and things like that can cause problems. So just understanding that there's different classifications, and protozoa are very often, I like to chunk them in the same category as things like bacteria, fungus, and then protozoa, parasites, all in that group together, where they're typically just housed in our microbiome, and we can have some that are there that, as long as our immune system is not reactive to them, it shouldn't really be a problem. When you get into worms, when you get into ectoparasites, things like that, it can kind of get a little bit different. So immune system reactivity can kind of change depending on what kind you have.
Yep, for sure. Yeah, I totally can second that. A lot of people, whenever I mention parasites to patients, they think immediately, they think like tapeworms, like huge tapeworms. I would say I have had patients pass parasites. We'll get into a little bit later how we find parasites and how we address them. But I have had patients pass parasites from time to time. And I would say the majority of the time, they're not like it's not like one huge tapeworm. Maybe, I don't know if you've seen this, but usually if people go overseas and then they come back with something, that's going to be your highest likelihood of having some kind of a tapeworm. But I would say those are not the most common things here in the States. I would say it's more of like the pinworms. It's probably the biggest thing. And then, yeah, a lot of the protozoa and things like that. So Dr. Tim, let's walk through the signs and symptoms. How might somebody know if they have parasites? Now, obviously these signs and symptoms range quite a bit, but walk us through some of that. What are some of the things that you would encourage someone, hey, consider this, look for this. If you have some of these symptoms, could be parasites.
With parasites, one of the first things I like to highlight is basically just the stuff that we've talked about in the past couple episodes. The gut is, I would argue, the most common place where parasites will take hold, especially protozoa, things like that, where you're not really going to see the parasites come out in stool. You're not going to pass them or seemingly pass them, things like that. So any sort of gut symptoms, constipation, diarrhea, bloating, gas, food sensitivities, things like that. All of the rashes and skin issues that can come with that. If you can get like heat rashes or itchiness, especially in the anal region or the pelvic region, that's super, super common. But then more systemic issues like fatigue, tiredness, sleep disturbances, all those things that more so resonate with just overall immune system hyperactivity leading to downregulation of the adrenals and the thyroid. Um, all of those things can be rooted with parasites. Now, there's other things on the list that can be more so associated with parasites. Sugar cravings, that can kind of be any sort of gut issue. Really, it can be just blood sugar dysregulation. That's not really a specific sign and symptom. But one thing that is, and I don't tend to focus on this one too much, but it is one that's talked about a lot, and it's one that a lot of people really, really buy into, is getting worsened symptoms during a full moon. The parasites are supposedly most active. I've had a lot of patients that could very well be that they have legitimate observations that they feel that things are worse as far as it goes for gut issues, sleep issues, you name it. Or, there could be the little bit of just psychosomatic thing going on there. I don't know what to make of it, especially, but when it comes to the topic of parasites, it is a very, very common thing that during a full moon, docs will even double doses of antiparasitic medications, or symptoms will get worse, or it'll be expected that you might hit some road bumps during a full moon. Those are, I would say, some of the top ones. But then, at least, just kind of something that we're going to get into later on, there are other conditions that can be caused because of this, where it's not just signs and symptoms, it's full-blown autoimmunity, it's various cancers, things like that, where parasites are huge at driving the immune system and over, where it just indiscriminately reacts to all kinds of things, but then lets things creep in over time. So it'll basically just react to yourself. So autoimmune conditions, things like that can arise, and you'll start hyperreacting to foods, bugs in your gut, environmental issues, histamines, you name it. But then from there, your immune system can actually get weakened overall when it comes to fighting off things that it should fight off. And that's, you can get the ability to fight off infections, cancers, things like that. So we're going to get into that in a little bit when we get into kind of the how to fix portion of this episode. But as far as it goes for signs and symptoms, just understanding that other conditions that you have may be rooted in parasite issues. And that kind of gets into that teach one, teach two balance that we always like to talk about. So, Dr. Joel, do you want to add signs and symptoms and maybe even dig into the immune system and explain that a bit more?
Yeah, for sure. So yeah, when it comes to signs and symptoms, if you have parasites, you're generally going to have gut issues. What another thing that's really common, of course, is rashes, any kind of skin issues. Now, you listed the majority of those different signs and symptoms where you can usually point back and be like, yeah, you most likely have parasites. But then there's also kind of that conversation of what conditions might you have that is kind of a telltale sign of you have parasites. I would say the top conditions that I've kind of seen, that's like, if I have somebody come to my office and they have this condition, if I was a betting man, I would put a lot of money that they have parasites. Those conditions are going to include, yes, cancer is definitely the top one there, but eczema and most skin rashes, but definitely eczema, bipolar disorder, depression and anxiety. Now, if it's just anxiety, that might be that could be related to a number of other things, but when it's depression and anxiety, that's where we'll usually see the gut issues, usually impacted by the parasites, the ammonia toxicity, increasing anxiety, all that stuff. And then another one that might be a little bit surprising is gallbladder attacks and gallstones are also extremely common with a lot of those things. Not the only thing. There's usually multiple different systems and things impacting that, but that's definitely one of those things. And I would say the last one that I would kind of add to that list from just clinical experience is reactive hypoglycemia, so low blood sugar type issues, where your blood sugar drops, you get exhausted, and that kind of thing. That's also one that's really, really common, mainly through the stress on the liver from having to cleanse the gut and the gut having parasites. And it's also possible to get liver flukes and things like that. So wanted to kind of throw those in there, just kind of something that I've seen quite a bit. Now, if you have these conditions, it doesn't mean that you have parasites. But as we often will say, it's more likely, I would say, than not. So those are the signs and symptoms. Dr. Tim, you also mentioned the immune system. And as we've talked about in multiple episodes, we have a couple key components to the immune system. We have Th1 and Th2. These things function not so much like a seesaw, but more of like a pump. So what do I mean by that? Well, if Th1 gets stimulated up from viruses, fungus, or bacteria, Th2 gets stimulated down. Your immune system should take care of this, and then the immune system should balance back out. Well, what stimulates Th2 is going to be things like parasites, heavy metals, food allergies, sensitivities, um, breast implants, chronic cortisol issues, and so forth. I don't know if I added vaccines, but vaccines are definitely on that list as well. But that'll stimulate Th2 up, and that Th2 issue, usually with those list of things, will usually stay there, and the immune system will seemingly get stuck, if you will. And that Th2 staying there does a couple of things. Number one, that issue leads to a ton of histamine production, which I would say is at the root of a lot of different allergy issues and a lot of different histamine intolerance issues. And so you have that component, but then number two, Th1 is suppressed. So now your immune system actually is weakened to fighting bacteria, fungus, and viruses. And so, Dr. Tim, that's one of those scenarios where kids will get vaccines early on in life, and then all of a sudden, because that Th2 immune system is ramped up and the Th1 is suppressed, now they start getting all these different sicknesses and illnesses. They start getting the bacterial ear infections. They start getting the viral infections, and their immune system just struggles with those things. And then before you know it, they have to get tubes put in it and all these things. And it all goes back to your immune system, what we put in our body and what impacts our immune system. If we can address those things, oftentimes we can reverse those things, undo those things, and balance out your immune system. But that Th2, Th1 dominance piece is really, really important when we talk about those things. So what do parasites do, and where does that play a role in that? Is that will also increase the Th2 component. It'll make your immune system weaken to fighting viruses, bacteria, and fungus. And then, of course, it'll increase a ton of histamine issues. And so that's kind of where that lands with the immune system. Dr. Tim, of course, if there's anything added to that, please do. Let's kind of jump into testing. Like, if somebody suspects they have parasites, what is the best way to go about finding that out? Let's walk through that together.
Well, with parasites specifically, we always talk about the gut. And so we've already talked about it many times. It's various stool tests, oats tests, things like that, organic acid tests. And then like GMF tests, that's a more specific stool test. Any stool test can really, there's so many different options out there that will walk you through, what types of bacteria, what types of fungus, what types of parasites are there, how your secretory IgA and other immune system markers are doing in the gut, all those things. And they all kind of paint the picture of what's going on. And the issue that I have with those is back to the theory of the immune system. Although things are present, although things may be there in more or less amounts, that does not dictate whether or not your immune system is going to react negatively. And so when it comes to parasites, you may have some there, but it does not necessarily mean that they are a problem, and it doesn't mean that your body is reacting to them negatively. Now, to kind of make this a bit more difficult to pin down, like you can get things like liver flukes or parasites they can be in your blood vessels. They can be in all kinds of organs throughout your body, just depending on where they want to grow. And so if that is the case, how do we identify them? And that's where a lot of times it's very, 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 very difficult to pin down location of parasites on labs. And that's where, just as a broad thing, as a part of, say, cancer treatments with functional medicine medical doctors, they'll do things like ivermectin and fenbendazole and a couple of those anti-parasitic medications for the sake of just covering that base when they're supposedly well studied and very safe medications for them to use, for the sake of just killing off these parasites, because they skew the immune system, make you hyperreactive and more susceptible to things like cancers, autoimmunity, all that stuff. But with parasites, they can be in the liver, they can be in the gallbladder, they can be, it can be in your brain, it can be all over the place. It's just a matter of where they decide to get into, and that's where, at least with staying in our lane specifically, we get into the muscle testing and we use our system self-care technique to figure out where things lie. And more often than not, if they aren't in the gut, we'll find them test off the immune system. And on certain occasions where things are kind of funny, we will find them test off of different organs, like liver, gallbladder, other issues, prostate potentially, things like that. But oftentimes, if it just tests off the immune system, that just tells us that the immune system is reacting to them. It doesn't tell us exactly where they're located, and then we have to use other indicators to kind of allude to where those things may be. So at least within our way of doing things and our scope of practice, using the muscle testing and using the anti-parasitic herbs is kind of the way that we go. And so we'll identify to a reasonable degree that there's indications for parasite issues, signs and symptoms that are associated with it, and if warranted, lab tests to support the testing. And then from there, if we utilize those herbs, more often than not, things do get better. So that's kind of the process that we tend to use. But locating, we can say with the muscle testing, yeah, it would appear that it seems your body is reacting to this, and then we do herbs that make a lot of sense, and then things get better. So it's you can't rely on the muscle testing as this is a definitive lab. We can take a biopsy of tissue, or we can take a culture, or we can grow whatever's in there, and then we can actually observe and see it. But we can use those neurologic indicators to allude to things, our best clinical judgment based off of that. So there's plenty of ways to go about it. We like to bridge that gap between labs that will oftentimes show you that a lot of things are reacting, and then from there, we use our tools to help find a efficient path forward. So it is a combo of things. Are there any other tests or other things you'd like to contribute that you tend to go to when it comes to lab work? And maybe just some general blood test things that we can talk about for if anybody has any blood tests they've already
Yeah, for sure. So that's you've pretty much hit it on the head there. The parasites and testing for parasites and finding parasites is one of the challenges to this whole topic and to actually addressing this issue. Obviously, in medical schools, chiropractic schools, they're not really teaching about parasites. They're not really teaching that parasites are at the root of a lot of these different problems. So when it comes into testing, there's not a lot of great tests either that help to really identify these things. And so you mentioned the stool tests. Obviously, as we've mentioned here today, and of course in other videos, stool tests can be really good at catching things like bacteria, inflammation, things like that. Their weakness is often catching parasites. So the status quo in functional medicine is if you run a stool test to check for parasites, if you find parasites, the person has parasites. If you don't find parasites, they could still have parasites. And that's kind of the frustration with things on the practitioner side. So, and that's not just one stool test, that's multiple stool tests. And so it's definitely frustrating. Now, blood testing wise, if you run a CBC with differential and the eosinophils are increased, usually those you want to see those around 0 to 3%. If those are increased above that, 3.5%, 4%, 5%, even up to 10%, that would be a sign that, hey, this could be parasites increasing this immune system marker. Now, there's different theories and thoughts as to why that happens. I think the one that makes the most sense from my research and understanding is the parasites are generally going to increase histamines. They're going to increase that portion of your immune system. And so that's why you'll see the eosinophils go up. Now, those will also increase with things like allergies, and sometimes inflammation in and of itself will increase eosinophils. So again, it's not one that's super concrete. Now, I guess I would caveat that with, if you see it up at eosinophils being up at 10%, I mean, it's a pretty good sign that either you have some serious allergy that just occurred, which you would know about, or you probably have parasites. But again, the amount of times that I've found parasites on a patient through the muscle testing, but the eosinophils are fine on the labs, or maybe they're at like 3.3%. The stool test looks fine. That the amount of times that we found that has been countless. Yet we address the parasites with the herbs or whatever we find based on the muscle testing, and their symptoms all resolve. And so it's kind of an obvious thing of like, well, obviously we got to the bottom of things, and from the testing, we think it was parasites, but we didn't find that on any of the other blood tests, stool tests, anything like that. So super, super common. This happens probably on a weekly basis, if not more. And so, can you run a stool test anyways? Yeah, you can. And if you want to give it a shot, go for it. That's what I tell patients, Dr. Tim, is hey, if you want to run the stool test, we can. It's going to give us a lot of information about your gut health in general. If you're wanting to run it just for parasites, just know that it might come back negative, even though I might still find it with muscle testing. And so, as you can imagine, that can create a little bit of confusion and a little bit of frustration. So, but Dr. Tim, that's identifying parasites, figuring out, okay, do we have them and what's that look like? Now, when we stick with and focus on the muscle testing primarily, we also have the ability to actually test, okay, what herbs are going to work for you. Now, there's anywhere from maybe 7 to 10 different anti-parasitic herbs or nutrients that we may check for patients. And Dr. Tim, I'm sure your experience is similar, since we've talked about this quite a bit and, of course, worked together in the past. But usually we'll find that out of those lists of anti-parasitic herbs, not every herb is going to work. I'll usually find that someone needs 1 or maybe 2 herbs on that list, but it's going to be different for every person. So, Dr. Tim, do you have a similar experience with that? And let's kind of jump into that. How do we get rid of parasites? And when you're working with patients that you discover this on, what's kind of your approach with that?
Well, with parasites, like I said before, I tend to chunk it with bacteria, fungus, things like that when it comes to gut issues. And when that's the case, it does end up being pretty standard that a need for at least 3 herbs, 2 weeks on each, starting 1, 2 weeks later do the next, 2 weeks later do the next. That tends to be pretty standard. Now, if it is testing in other places, that's when if it's off the immune system or if it's off of different organs, a lot of times it's just 1 or maybe 2 that are required. I think that's just with balancing the gut as a whole. It just takes a little bit more, along with other things that are in there that may be reacting, making this parasitic issue worse. Not entirely sure if it's just how things tend to test. That's why you use the muscle testing to identify what is required, when it's required, all those things. But I mean, herbs that are on the list, some common are things like mimosa pudica seed, artemisia, or Chinese wormwood, black walnut, super common, andrographis, and then something called noni fruit, or from Supreme Nutrition called morinda, and things like astragalus, gentian root. All of those things are really, really good ones. There's some more off the wall ones like the silenic acid. I'll often see that one test well, but it won't actually clear the problem with the muscle testing. And so, I haven't given that one out in a long time, just because it just doesn't clear the problem. And so, for those of you that are listening, have no idea what that even means. It's kind of difficult to describe, but our testing technique, system self-care, that we've learned from Dr. Stevie and Jimmy, there's a system of checks and balances where we can identify, what things are helpful for an organ and use our clinical judgment to, maybe add or subtract some things. But then from there, there's other checks and balances we can actually identify and see which nutrients are specifically required to fix that problem and move on to the next thing. And so when we go through and you say, okay, there's like 1 or 2 that will test for somebody and 1 or 2 that won't test, I'm sure you've experienced this. Have like 6 that test well. And so you're supposed to have people take 6 things, or what's the system that you use to figure out exactly which 1 or which 2 are going to fix the problem? That's where we use those other checks and balances to actually identify that. Within a more, I don't even want to say traditional, functional medicine isn't really traditional, but a functional medicine model that isn't utilizing muscle testing with it, you're going to do a broad spectrum of different things like that and just do it over more time and take a lower dose. And so it can take a lot longer to fix problems at that point. So anyway, we basically just work down our list of these herbs and see which ones test, see in a couple of weeks, and then if things go really well, it's not tested. But if things are still testing, we just identify which one is now testing. And we've gone from the most reactive strain to the next one in line. and then see a follow up next time after that. Hopefully things are gone. But then there's the other side where it's detoxifying other byproducts of those actions that we really need to get into. So kind of just highlighted the list of herbs that we will often see. Of course, our list is not a list that everybody will use, but those are just ones that we tend to see clinically. But there's plenty of other things to get into with that.
For sure. Dr. Tim, I might add to that list Oregon grapefruit and juniper berry. I'll see those every once in a while. But Dr. Tim, I was curious, we've talked about this where with muscle testing and different areas of the world in the US, we'll find certain people, certain areas need certain herbs more than others. Have you seen anything like that in there where you're at in Arkansas? I know that you've mentioned that in general you don't find as many parasites, maybe as when you were up in Minnesota or St. Louis. Tell me a little bit about that.
Well, running joke that I like to just show people in the office is if you have parasites, you either are not from the area or you recently or not that recently traveled.
Yep.
Because people that are just locals and they've been here forever, I don't know if it's just that they're just not found in the water here as much or what, but I just don't find them here a whole lot. And it's always, I'll get on the phone with somebody and they're like, I went on this mission trip and then I've had issues and they gave me these medications for parasites. They said they're gone, but I still have issues. And we get into the office, we test things, and there's still parasites. Or it's I went to Mexico for to this all-inclusive for vacation, or I went on my honeymoon. Got my stomach didn't feel quite right, and then came home. It kind of normalized, but I still every now and then I'll get diarrhea or something. And there's always that kind of story that goes with it, Or it's just, hey, we moved here because of Walmart or supplier or just where in this area we have this just boom of people moving here because of Walmart headquarters and all the other companies that supply stuff for Walmart. And so there's a ton of people moving here all the time, and people will move from all over the country, all over the world. And more often than not, if there is a parasite issue, they just tend to fall in those categories. They traveled or they're moving here from somewhere else. People just don't tend to find it as much. So it just always rings in my ears that they're not from here. But when I do find parasites, the list that I gave, it's kind of a crapshoot to see which ones test. I don't have any specific, just, I always see this one for parasites. Mimosa, Artemisia, black walnut, those are top ones, as well as gentian and noni. But that basically highlights the entire list.
Yeah.
That's not really excellent information. Now, if we were talking bacteria and fungus, there's other ones that I do see more often, but no, parasites. Maybe it's just because the sample size is a little bit smaller because I just don't see them as often.
Yeah.
Not entirely sure.
Yeah, that's fair. And also, if you mentioned, like you said, most people that you're going to see that have parasites have been traveling somewhere. Well, I'll see that people that usually come from, Mexico or something, they probably need Mirinda. So I'll see some of those different trends based on kind of where people travel and whatnot. But obviously, nothing is like 100% set in stone. One of the things I found out here in Texas, I thought was really interesting. When I was in Kansas, St. Louis, Virginia, even. In Texas, I've found a lot of people need andrographis. Again, I'm not super sure why, but I find that one to pop up pretty commonly. And then one of the most common things I would say I'll find is essentially the need for either usually black walnuts or Artemisia. And I know those two are really, really key for like pinworms. So I'll find those as well. Dr. Tim, thanks for sharing a little bit about kind of your approach with just kind of the different herbs and kind of 2 weeks at a time and just continuing to recheck those things and see kind of what's testing best. One of the things that I've found that to be pretty helpful is when it comes to black walnut and Artemisia for pinworms, a lot of times I'll find that those herbs do best taking them for about 6 weeks. That's not in every situation. I've had some people that just need it for about 2 weeks or so, but 6 weeks. And the reason that kind of the way that I found that was by finding that a lot of people kind of would have parasites. They test for black walnut or Artemisia or whatever it is. And I have them take it for about 2 weeks and then come back and they're good. They test fine. But then the next visit, maybe 4 weeks, 6 weeks later, they'll come in and it's literally patient after patient will do this in these situations where oh, I was getting a lot better and I was really good. And then some of my symptoms started coming back. And then we get back in and work to get to the bottom of things, and we find the same thing. And my conclusion with that has essentially been that parasites, of course, lay eggs. And when you take an herb like black walnuts, Artemisia, for about 2 weeks, you'll take out the majority of parasites, but then those eggs will still be there, and those eggs can hatch over time. And of course, we've talked about kind of the full moon, the new moon. Those things are going to happen, of course. Every 2 weeks, you're going to have one of those things. And so essentially what I found is that over the period of 6 weeks, if you take the herb for about 6 weeks, you'll actually go through, yes, all the kind of adult parasites, but you'll go through the eggs as well as they hatch. And you actually get to a point where like they're all gone. And they don't come back. So that's kind of one thing I've noted. Again, that's not in every situation, but it's been common enough for me to notice that and actually find that that's a really, really been a really successful approach with patients and parasite issues. All right, Dr. Tim, this has been great. I'm trying to think, what else do we have here? I guess one of the things we also have with parasites is, talking about the different side effects or toxins that come off. There's two things we usually talk about. We talk about aldehydes and we talk about ammonia. I think the biggest thing that I share with patients when it comes to these two things is these are toxins coming off of these different infections, usually parasites, bacteria, or fungus. Those are kind of the main players there. And those toxins are then going to do a couple things. Number one, they're going to stress a certain system in your body. It'll stress your kidneys, it'll stress your gallbladder, your liver, whatever detox organs. Number two, it'll run your body down on nutrients. So one of the common things I'll see is you have maybe parasites, for example, ammonia toxicity from that. Now that ammonia toxicity, your body's trying to detox, and maybe your body's using magnesium to detox that. Well, now you have a magnesium deficiency because your body can't keep up. Well, now you have a magnesium deficiency, and then you start having anxiety. You start having sleep issues. You start having hormone imbalance issues. The list goes on and on. But Dr. Tim, aldehydes, ammonia, these are things that you're seeing quite a bit in practice as well?
Yeah, absolutely. Token nutrients that I'll have people take that just tend to test: vitamin D3, niacinamide, molybdenum. And then when it comes to ammonia, a lot of times I'll see a need for things, vitamin B6, B3, but then like the arginase enzyme. So Standard Process has a product called Arginex, which helps clear arginine. And when you get toxic with ammonia, that is one of the byproducts of that, where you just need that enzyme to break it down. So that's really good at helping sickness as well, because whenever there is protein breakdown, there's tissue breakdown, parasite breakdown, you name it, there's going to be ammonia breakdown problems, because you need resources to break that down. If it's a chronic issue, you're going to drain those resources. That's where all these things can be super, super helpful. So definitely, just like with all kinds of other things that we talk about regarding infections, whether it's the gut, immune system, you name it, deal with the infection through the antimicrobial herbs, and then from there deal with the byproducts, whether that's ammonia, whether that's aldehydes, whether that's bleach, whether it's hydrogen peroxide, name it. Deal with those things and whatever nutrients are required to fix those, and things should be good. So as far as for a protocol to fix this, it is just fix with the herbs, fix the byproducts of it. Put it super, super basically. That's kind of how things tend to go. So
Yep.
when it comes to fixing that, kind of the steps that I have people do, just with what's testing. Now, we do have some other notes on here regarding like other suggestions that we can provide for people, maybe for like maintenance care, things like that, or nutritional changes. Do you just kind of want to walk us through what kind of things you're suggesting for those things?
Yeah. So you mentioned protocols. I'm glad you brought that up. There are so many different supplement lines, so many different holistic doctors online that will recommend, hey, do this parasite cleanse protocol. And here's the thing: we've spent a number of minutes here talking about the fact that people are usually going to need one or two herbs for the parasites. So protocols where you have 8 to 10 different herbs, oftentimes you'll have some that help, some that don't help, and then some that actually cause issues. And so they don't always work. I don't recommend protocols. I recommend we figure out exactly what herbs you need. A lot of patients ask if we should be doing herbs bi-yearly, every 6 months as a general cleanse. I encourage you, if you have access to a holistic applied kinesiology doctor, get an appointment every 6 months and just have the muscle test to see if they've come back or if you have issues. The other thing is you want to pay attention to the symptoms that you have when you have parasites. For me, when I had parasites, I'd have eczema, I'd have anxiety, things like that. For other people, it's diarrhea, it's constipation. So pay attention to those signs. And the last thing is, do people need to make any nutritional changes when addressing parasites? And I would say, do you need to be avoiding meat? Do you need to be avoiding raw seafood? All these things. I would say ultimately, no. I would say ultimately you want to change the environment. You want to strengthen your immune system, and that will address things. All right, Dr. Tim, we are out of time, so let's go ahead and wrap up. To our listener, I hope that you guys have enjoyed this, and I hope that you find this to be helpful. Let us know if you have any questions. We're here and happy to help. Like I said before, my name is Dr. Joel Miller. I'm here with Freedom Health and Wellness in the Dallas, Texas area. You can find me online at drjoelmiller.com and on YouTube and Instagram. Guys, if you have any questions or need any support, definitely reach out. We'll be happy to help. Dr. Tim, share about how people can find you, and then go ahead and wrap up for us.
Yeah, absolutely. I'm Dr. Tim Augustyniak here at Flourish Functional Wellness Center down in Bentonville, Arkansas. If you have any questions, comments, concerns, suggestions for future episodes, feel free to reach out. You can find me online at draugustyniak.com. It's DRAUGUSTYNIAK.com. On the homepage, I have links to my socials as well as all the contact info for the office. Go ahead and reach out if you guys need anything. Thanks, as always, for listening. Hope you guys enjoyed the episode, and we'll see you next week and the next one.